November is National Hospice Month. It's a month dedicated to honoring patients nearing life's end and to support their families during that difficult time. Dr. David James tells us how hospice care works in this week's Health Watch.
Each year, nearly 1.5 million patients receives hospice care. Hospice care is a service that provides expert medical care, pain management, emotional and spiritual support to those facing a life-limiting illness.
The overall goal of hospice is for our patients to die comfortably and to have them die with dignity.
In most cases, hospice care is provided in a patient's home, but may be also provided in hospitals, nursing homes, or other long-term care facility. The care is often carried out by a diverse group of healthcare specialists.
We operate as a team, and on our team is a nurse, social worker, chaplain, and nursing assistant that go into these patients' homes and care for the patient and the patient's families.
And members of that hospice team will also develop a care plan that meets the individual patient need in order to maximize their comfort while they're in their final days.
Our nurse comes into the patient's home at least once a week, more often if the symptoms are getting worse or we need some better pain management. We have nursing assistants that come anywhere from 2 to 3 times a week. We have a social worker and a chaplain that also come in. And the social worker and the chaplain really depend on what the needs of the patient and the family are. Sometimes they come quite often, or they can just kind of come in at the end.
Some hospice care services also go beyond serving the individual by extending support to the families of the patient. Most services do this by offering bereavement programs to help family members cope with the loss of a loved one in their lives. For this week's Health Watch, I'm Dr. David James.